The conveniences of telemedicine are really the lack of necessity of having to get in the car and come to the office. Any follow-up that probably doesn't involve any kind of complicated physical exam, especially mental health follow-up visits, seeing how people are doing on their medications, if we've added or modified them in any way. People with hypertension or diabetes who are more here to review their numbers and make sure that they're well controlled or make slight modifications to their regimens as well. And some common infectious diseases like sinusitis or urinary tract infections can be handled through telemedicine. There's always the caveat of bringing a patient into the office if they need to, if a physical exam is warranted. Do telemedicine visits take longer or shorter than typical office visits? Probably most of them are a little bit shorter because there's no rooming process, there's no real check-in process per se in the office. Obviously there's a lot of variability depending on what a patient tells you, but I've found generally speaking these are a little bit shorter than an in-office visit. What sort of responses have I heard from my patients using telemedicine? It's generally been overwhelmingly positive, especially the parents have really enjoyed being able to communicate with their pediatrician regarding their babies, how feeding is going, how development is going. And in general, during the pandemic especially, a lot of people have been very, very relieved to communicate with their doctor and discuss their fears and anxieties and have a lot of them assuaged during the visit. How do I think telemedicine is going to change when the pandemic is over? Telemedicine has been around. It's not a new technology. Like a lot of things in life, it has to do with the payers. It has to do with what insurance companies are willing to pay for or what patients are willing to pay for. I think that there's a real window of opportunity to provide a form of healthcare to our patients at a lower cost and a greater efficiency in certain pockets where it's appropriate. There's always going to be a need to do a physical exam on somebody. If your ankle hurts, I need to examine your ankle. If you're worried you might have pneumonia, I need to listen to your lungs.